Several of you have asked for a blended learning example. In most cases, you're going to read the chapter, then answer the quiz questions, and then watch a blended learning video. This video, for example, provides information about the early history of U.S. healthcare. It also provides you information so you can engage in a higher level of learning during our live class sessions.
The reconstitution of the hospital is a term used by Starr, but if you look back in history and look at the mid-1800s, hospitals were primarily religious and charitable organizations that tended to the sick rather than full-fledged medical institutions. Then in 1870 through about 1910, hospitals began to change, particularly with the founding of Johns Hopkins University. And hospitals then became the center of medical education and medical practice. As hospitals changed, their costs and overhead increased. At the turn of the century, in 1900, Roosevelt was president, and he was going through what's referred to as the progressive era. And so what had happened is, big business, or during this industrial revolution, companies had gotten very monopolistic, so he had antitrust enforcements that he had to break up some of these companies, including manufacturing, transportation, some of the big oil companies. States were also dealing with the fallout of the Industrial Revolution. They were shortening work weeks and limiting child labor and controlling workplace injuries. And so what was happening was that employees were getting injured on the job. The company was blaming the employee and was kind of left out in the cold, and this is what led to workers' compensation insurance. Between 1910 and 1915, some 32 states enacted workers' compensation laws, and under these laws, employers accepted full liability for workplace injuries. In exchange, they were able to buy insurance coverage through the states. In the beginning, the American Medical Association supported workers' compensation laws because the physicians felt that the patients would get injured and then come to them for treatment. But in reality, some of the companies would retain their own doctor or hire a doctor and treat their employees, thus leaving the physicians out in the cold who previously had these patients. So the AMA reversed their decision about 5 years later and said, no, this violates doctor-patient relationships. So at this point, we've seen a change in the hospital structure. We've seen a change in big business with the Industrial Revolution, some of the companies being broken up and having to provide workers' compensation insurance. And now, to make matters worse, the country has a Great Depression in 1929. But the Depression was a catalyst for present-day insurance, because what happened was hospitals they were not making the revenue that they needed to, so they had to figure out a way to pay for insurance and to pay for these hospital bills. And so a gentleman named Justin Kimball, the administrator of Baylor University, devised a means to pay for hospital care. So what he did was he enrolled 1,250 Dallas public school teachers into what he called the Baylor Plan, and each one of those individuals paid 50 cents a month with a promise to be provided 21 days of care in the hospital. The Baylor Plan spread rapidly among hospitals, and the American Hospital Association quickly grasped the plan and later on developed the AHA Blue Cross Commission in 1946. What also fueled Blue Cross Blue Shield is that the plans were all nonprofit. They covered hospital charges only and allowed for a free choice of physician. Therefore, guess whose support you have? The American Medical Association. And also, they had exclusive geographic market areas. And even today, Blue Cross has some exclusive markets. Another important event, which kind of lays the groundwork for health maintenance organizations, or HMOs, was in 1933, Dr. Sidney Garfield established the Kaiser Foundation. And what was different about it is he was paying physicians a salary, and this caused a big uproar with the AMA because it disrupted their sliding fee scale and therefore cut into their profits. Well, later on the conflict was resolved once the the federal government stepped in and enforced the Sherman Antitrust Act. Sadly, the Kaiser Foundation and other health organizations at that time that were paying salaried physicians struggled for almost 10 years until the Supreme Court held against the AMA in 1943. As I mentioned before, the AMA supported the hospital plans established by the Blue Cross because they were allowed to pick the physician. The next segment or presentation will deal with some of the changes that happened with World War II in 1941, and we'll talk a little bit about price controls, how organized labor became a bigger player overall as far as getting more insurance, and then some of the tax structure and federal tax codes that changed during that time frame.